We will now go into an overview of psychodynamic, or otherwise known as psychoanalytic, family therapy methods, and beginning with talking about some of the figureheads that are most commonly associated with this practice would be Nathan Ackerman, Murray Bowen, and from an individual point of view, Heinz Kohut, who is associated with the model of self-psychology, was very influential in these ideas about that come into play about being able to um, understand family in the way that people develop and evolve from their early childhood experiences. And this couple here, Scharf and Scharf, is a husband and wife team that incorporate a lot of object relations into family therapy. Object relations has to do a lot with how early ideas about self-concept are influenced by how a primary caregiver treated and reflected back onto children. So you can go to these two websites, which provide a little bit more information from a couple's point of view about how psychodynamic and psychoanalytic theories influence how we choose the partner that we want, um, based on sometimes these unfulfilled needs and wants from our childhood, and how we can use those to our advantage to have better relationships in the future. So those are gettingtheloveyouwant.com and passionatemarriage.com. Now, working with families from a psychodynamic point of view, the major premise there is that people need to gain insight. They need to have a better understanding of their problems to be able to resolve those problems. However, research has shown us over and over again that having that insight, understanding maybe the why something is problematic to a family, is not sufficient. We also need to be able to get in touch with the emotional aspect of some of our what you might consider to be root problems. When you drill down beyond the surface level stressor or the surface level problem, and you look more deeply at more entrenched ways of relating to one another, then we're starting to look at root causes of things. And what this model of doing family counseling would say is that when you look at those root problems, you need to be very in touch with what the feelings are associated with that, because what will likely happen is that those root problems and their associated emotions often get masked over by the more surface level stressors or conflicts that we have in day-to-day life. For example, we might have something at a root level of feeling unloved or unwanted in a family situation, but on the surface, instead of that showing as hurt and a feeling of wanting to be loved or loneliness, what comes out might be aggression or anger or irritation. Um, Another aspect of this model is it says that the way that children behave often will reveal information about the unconscious family life. So sometimes children are acting out broader themes present in the family. Family counseling should also be a holding environment, and what's meant by that, that's a very important term, holding environment. It's meant that um, that counseling is a place where you can come and you can maybe take feelings to a deeper level than you're able to do in the real world, and that the counselor isn't going to unnecessarily escalate those feelings or de-escalate those feelings, that you can fully experience the feelings of this emotional experiencing within the root problems, and feel safe enough to explore those, but know that you're safe and you're in a safe environment, and that you will be trusted, and there'll be a non-judgmental approach, and you just primarily that you can be safe, and that the therapist can hold and contain those intense emotions that you're having or that the family is having. Another premise that's important to understand is that children don't need perfect parents, they need good enough parents. And sometimes, even when parents make mistakes, those present wonderful learning opportunities for children to start to rely more and more on themselves, which is part of the goal of growing up, is that kids will begin to move away from their family. And if we have a perfect parent situation, then the child doesn't have enough opportunity to rely on their own sense of self and build self-esteem and self-confidence in their ability to make decisions and learn from mistakes and so forth. On the other hand, if there are too many mistakes that happen, that doesn't provide the kind of safe attachment relationship that's needed. So 3 important concepts would be resistance, splitting, and projective identification. Resistance commonly pops up in a family member saying, oh, I don't want to talk to the family therapist in a group. I want to get one-on-one. I'd rather do individual counseling rather than do family counseling. What I have to say is private and personal, so I don't want to talk about it in the family situation. That might be a form of resistance. Also in a family counseling session, if one member talks mostly to the therapist rather than to the other family members, that can be a form of resistance. Avoiding conflictual topics can be a form of resistance. Scapegoating, where one person puts all the blame onto another family member. Becoming depressed to avoid confrontation. This is something that happens all too often in family situations, is that one family member's depression is a way to avoid actually dealing with some conflict that needs to come out and happen in the family. And as a family therapist, what you want to do if you see any of these things is you want to be able to interpret it directly and deal with it immediately. And you want to push the family to go a little bit past that comfort zone or that typical way of being and call it what it is and deal with it. Splitting is another common situation that family counselors would be wanting to look for, and that's sometimes where you'll have that there's one bad parent and one good parent, or there's one good child and there's one bad child. And we know that people are very complicated. All of us as individuals have some things about us that are good and easier to get along with others than, and everyone has their flaws as well. So what this splitting mechanism is looking at family members in this dualistic point of view that really isn't realistic or helpful to family and to family life. And so nobody is either all good or all bad. Everybody has their strengths and their weaknesses. But someone who uses splitting takes the power and emotional intensity of a situation and puts it all into one. Kind of the a devil child, angel child type of scenario, or golden child, bad seed kind of situation. And then projective identification is something you want to be on the lookout for parents to do to make sure that they're not doing, or partners. And that's usually when someone doesn't like an aspect of themselves, but recognizing it in themselves is very difficult. So they identify with that behavior in other people, and they'll complain very loudly. They'll strongly object to that behavior in someone else. And it's a way of cutting off from that part of themselves and not having to deal with it in themselves. So you react to the parts in other people that you actually don't like within yourself. And so sometimes a parent might see that in their child, aspects of themselves that they don't like, and then punish and react very negatively or more strongly than you might anticipate to situations where that child is portraying that characteristic that the parent does not like in themselves. The big function that all of these symptoms, when symptoms are problems that come up in a family, and when those symptoms pop up, what they're usually trying to do is it's a way that the family can deal with its anxiety. And so the family, rather than confronting that anxiety head on, comes up with all these different types of ways of being able to respond to difficult situations without feeling threatened. So some things that might pop up would be separation anxiety, that's weakening the ego, parents' failure to accept their children as separate beings, and then that results in some dependency problems. Narcissistic personality being developed from a child who goes looking for an admiration that they should have gotten from their parents but did not. And then this last bullet point here relating to the previous slide on projective identification, where people react poorly to the qualities in others that they have rejected in themselves. The healthy families from this point of view would demonstrate that children receive reliable, loving support from empathic parents, that both separation and identity formation are characterized as part of a lifelong process. And so there is considered to be this moving away that is healthy and good and expected and wanted to be promoted from that original family of origin, and that happens gradually throughout childhood, more so during adolescence, and more so during early adulthood and later adulthood. Pathology in families would be seen as hiding real needs, operating from a false sense of self, so not being authentic, and concerns are not verbalized due to fear of anger or disapproval or because the concerns are unconscious. And this goes back to the strongly held beliefs in psychoanalysis and psychodynamic theory that the unconscious motivations or feelings that we have can wreak havoc on our lives. So as counselors, we want to help make those unconscious thoughts and desires and feelings and anxieties come to the surface and have those become conscious, because when they're conscious and we are aware of them, then we can make better decisions. The therapist is to listen very intently without becoming intrusive, so a less direct role than some other models of family counseling, to express a great deal of empathy, to decide who should be included and who should be focused on, not to offer advice, not to offer reassurance or confront families, they do that for themselves, and direct treatment to feelings to address root causes. So the counselor would be working to be in somewhat of a parental role, but also bringing the family more deeply in touch with their feelings. It may be short term, but usually it's a little bit more long term type of work. And there is some time spent looking at past conflicts to relieve present day symptoms. There would be both a hypothesis related to what the intrapsychic phenomenon is of the individuals, as well as the interpersonal processing of the family members with each other. So you're thinking both individually and from a systems point of view. But you want to, as I was saying earlier, you want to make the unconscious conscious and verbalized. You want the family members to be autonomous and to grow. You want to help resolve immediate crisis and then focus on a more long-term way of changing and being with each other that's more productive. And you want to help all of the family members to be independent, not clinging to each other, and try to balance between the burdens and benefits of adult life, of which there are many. So the major techniques would be listening. A lot of family counselors might want to do something, but this approach says hold back from that pressure to do something and listen, rely heavily on conveying empathy, do a little bit of interpretation, especially as related to past childhood memories and how individuals are reenacting some past things in their present day life. You want to try to be neutral, and you want to work through your own countertransference issues, of which we all have. So here are some assessment questions that you can go a little bit more detail into on your own, and some additional things that you want to be thinking about as you go through work with the family and you're trying to bring out those emotions that are such an important part of resolving root problems. Why this feeling? Where is this feeling coming from? What do you want from your partner? What were you expecting from your partner in that moment? How have you felt this way before? And how about even before that? And that's helping to walk somebody through feelings and get them more in touch with more historical events that might be at play. So a lot of the root causes that everyone has would be summarized in psychodynamic thought by these three questions at the bottom of this slide. Am I okay? Will I be alone? And will I be able to survive? So when you boil down a lot of people's anxieties and problems and feelings, at the bottom of all of those is this: am I okay? Am I normal? Or am I lovable? Will I always be alone, or will someone actually know and love and care and value me for who I truly am? And will I be able to make it through life? Will I be able to deal with the stressors and things that come my way as I move through life? So those are what's at the heart of what a lot of people are concerned about.